and I want to welcome each and every one of you to our Wednesday night webinar. I'm Dr. Rita McGuire. I'm the Chief Medical Officer for Wakana, and we are going to talk tonight about sarcoidosis and how CBD can help. So just a bit of an overview about sarcoidosis. It is truly a disease entity that experts and healthcare professionals don't fully understand the cause. There is some belief that the disease manifests when the body's immune system reacts to unfamiliar substances. And basically what happens in autoimmune disease entities like sarcoid or scleroderma or lupus is that the body thinks that there are organs that we have like the lung or the kidney and the liver, and it looks at those organs as foreign objects and starts to attack those systems. Some examples of what's the body's immune system is reacting to is unfamiliar substances, which can include bacteria, viruses, chemicals, dust, or the abnormal reaction to self-proteins. We'll talk about those. And when exposed to these kinds of substances, then the body responds by forming a lot of inflammatory cells, which form into granulomas. Some people are genetically predisposed, but currently there's no cure for sarcoid. However, most people with the disease respond very well to modest treatment or no treatment at all. As quickly as sarcoid can appear, it can also disappear and need no treatment. So it can go away on its own, but sadly for some people, sarcoidosis could last for years and may cause organ damage. Many of you on the line may remember Bernie Mac. Bernie Mac was just one of my favorite comedians. He was diagnosed in 1983 with sarcoidosis, and unfortunately, he passed away on August the 9th of 2008 from complications from pneumonia. Right now, the Bernie Mac Foundation truly has raised a lot of awareness as it pertains to sarcoid. I know that when I was in medical school in the early 1990s, it was really rare for us to see autoimmune diseases like sarcoid, like lupus, like fibromyalgia, and so many other autoimmune diseases that we see today. So what exactly is sarcoidosis? It is a disease characterized by the growth of tiny collections of inflammatory cells. And I really want you to focus on what's going on. It's a lot of inflammation that the immune cells develop a lot of abnormal activity, and these inflammatory cells turn into granulomas in the body. So this disease commonly occurs in the lungs and lymph nodes. However, sarcoid can also affect the eyes, the skin, the heart, and other organs. So you can see here in this diagram that there is abnormal activity of the immune cells, and that activity, that inflammation, and even the body thinking that these organs like the lungs are foreign, they start to develop inflammatory clumps called granuloma, and then they start to attack organs, which lead to a lot of the symptoms that we see in sarcoid. Some of the risk factors for sarcoidosis is age and sex. Sarcoid typically occurs between the ages of 20 and 60. Women have a higher risk of developing the disease, and those who are of African or Northern European descent, particularly Scandinavians, have a higher incidence of sarcoid. There's also a genetic predisposition, so there's a chance of developing sarcoid and higher. The incidence is higher when someone in your family has had the disease. So signs and symptoms, again, vary. They vary depending on the person, and they vary depending on which organ is affected. Symptoms can last for years, or they can appear and disappear as quickly as they came. Then, there are people who have no symptoms at all. And the doctor may find and discover the disease by an incidental finding on a chest x-ray. So some of the general symptoms that we see in sarcoid is swollen lymph nodes, fatigue, weight loss, pain and swelling in joints. Some other symptoms that we may see is dry cough, shortness of breath. You can see by the diagram here that sarcoid can affect almost every organ and gland in our body, from our brain to our lymph nodes to granulomas noted in the lungs, attacking the liver, the skin, the spleen, again, the eyes, as well as joints that we see a lot of inflammation. So we can go from having symptoms of chest pain and difficulty breathing, which means that sarcoid has started to affect the lungs. And then we can have burning, itching, or dry eyes that we can see now is starting to affect the eyes. It can also impact calcium metabolism, the spleen, the nervous system, and even muscles. So you can see here that every organ can potentially have an inflammatory response or a foreign body response where granulomas start to develop in all of these different organs in the body. So a very devastating disease entity. So let's look at the lung and some of the symptoms. We talked about persistent dry cough, shortness of breath, even wheezing. There are some people that have been misdiagnosed as having asthma, and they really have developed an autoimmune disease called sarcoidosis, as well as chest pain, which can be hard to differentiate in someone who may be having a heart attack. Some of the skin symptoms are rashes. The rash is typically a rash that's red or reddish purpley bumps. It's located typically on the shins or the ankles. There are also sores. There are lesions that can occur on the nose, the cheeks, and even the ear, as well as dark or light color areas on the skin can be also signs of sarcoidosis affecting the skin. There are growths that can occur under the skin, particularly around scars or previous tattoos. Let's look at the other issues. How about with the eye? Eye symptoms include, again, blurred vision, eye pain, burning, itching, or dry eyes, severe redness, and sensitivity to light. Many times, these symptoms can be confused with pink eye or uveitis, inflammation of the eye, and sometimes even glaucoma or macular degeneration. Heart symptoms include, we talked about chest pain, shortness of breath, fainting, irregular heartbeats, arrhythmias, even palpitations and swelling caused by excess fluid or edema. Again, these symptoms can be confused with those who may be having a heart attack, or those who may be having an asthmatic flare, or even those who are having issues with heart disease when it's really sarcoid. Some long-term problems that we see with patients who have sarcoidosis are affecting the lungs, which can lead to pulmonary hypertension and even the demise of Bernie Mac, complications due to pneumonia. Long-term problems affecting the eye can even lead to blindness. Those affecting the kidney, it can cause kidney dysfunction, which can lead to dialysis or even multiple kidney stones that are affecting the metabolism of calcium in those who have sarcoid. In the heart, granulomas can form in the heart. Those are inflammatory cells that start to affect the heart as if the heart was a foreign body. It can disrupt the heart rhythm. It can disrupt the blood flow, as well as it can disrupt the normal functioning of the heart. Even the nervous system, there's something called neurosarcoidosis, where the nervous system, the central nervous system, can be affected by inflammation and can cause meningitis and even dementia in those who have sarcoidosis. So some of the treatments, we talked about the cause, is unknown. It suggests again that the body is looking at different organs like the liver and the lung and the eyes as foreign bodies. And what triggers that response? We're not sure, but it could be a bacterial or a viral infection. Genetics has also been considered a cause. But rest assured, sarcoidosis is not contagious. Currently, there's no cure for sarcoid, as the condition goes away on its own many times. However, there are medications that we use currently to treat chronic symptoms from sarcoid. We use medications like corticosteroids, hydroxychloroquine, and even tumor necrosing factors inhibitors that act to decrease inflammation. Well, I can't stress enough about diet. When we take any chronic illness, any autoimmune disease entity, we've got to go back to our diet, right? A diet that is great for those who suffer from sarcoidosis is a plant-based diet. Can't stress a plant-based diet. Why? Because a plant-based diet gives you all of the vitamins and minerals from your fruits and vegetables. There is no room for those who have autoimmune disease, be it sarcoid, be it lupus, be it fibromyalgia, be it rheumatoid arthritis, any of the autoimmune disease entities. You need to be on a plant-based diet, because diet that is full of processed food, fried chicken, mac and cheese, some of the foods that we eat on the line, all of those foods are high in inflammatory properties. So you want to stick with a plant-based diet. And then we want to move on to CBD, cannabidiol for sarcoidosis. Well, let's first talk about the cannabis plant. The cannabis plant has two species. One species is the hemp species, and that's a species that we're going to concentrate on tonight. That species contains a high level of CBD or cannabidiol and very trace levels, less than 0.3% of THC. Now, species 2 is the marijuana species. That also contains CBD, but very low amounts of CBD, and it contains higher levels of THC, more than 20%. Well, let's look at what these cannabinoids at the cannabis plant looks like. And what are their medicinal properties? Well, we can see from this wheel, this full spectrum wheel, is that CBD truly is the hero. It has so many properties that we've already talked about that could be possible causes of sarcoidosis, right? We talked about the fact that sarcoid couldn't be triggered by bacterial or viral infections, or even just the immune system going crazy and being out of whack. So CBD is an antibacterial. CBD also inhibits cancer cell growth. It's neuroprotective, and that's really important in those who have something called neurosarcoidosis, where inflammatory cells start to attack the brain and causes meningitis, which is inflammation of the meninges, as well as cognitive dysfunction like Alzheimer's or dementia as we see it. It also, CBD promotes bone growth. It reduces seizures and convulsions. It reduces blood sugar level. It reduces the function of the immune system. We talked about that, right? Sarcoid is when the immune system is going crazy. It's out of whack. It's attacking the lungs, the liver, the eyes. it's acting as though these organs are foreign. So CBD comes in and puts the immune system back in balance. CBD also reduces inflammation. We talked about how sarcoid is a collection of inflammatory cells that then produce granulomas that then start to attack different organs and glands in our body. CBD also reduces the risk of arterial blockage. It reduces small intestinal contractions. It reduces nausea and vomiting. And that's really important because some of the treatments that we give our patients for sarcoid causes nausea and vomiting. It relieves pain. We talked about how sarcoid causes swelling and pain in joints. It relieves anxiety. You best and believe that those who have sarcoid deal with a lot of anxiety and depression because of the unknown and the long-term sequelae from having sarcoid. It also slows bacterial growth. Again, we talked about how one of the possible causes of sarcoid could be triggered and stem from a bacterial infection. CBD suppresses muscle spasms. It's tranquilizing and treats psoriasis, eczema, acne, and other skin lesions that we see also in those who suffer from sarcoid. And CBD is a vasorelaxant. We can see the other cannabinoids like delta-9 tetrahydrocannabinol, which is another common cannabinoid that the plant makes, also has medicinal properties in reducing nausea and vomiting, relieving pain, stimulating the appetite, and suppressing muscle spasms. But let's look at some of the other cannabinoids like CBG and CBC. We see that they also aid in sleep, as well as all of the other medicinal properties in slowing bacterial growth and decreasing inflammation. That's really huge because, again, when you deal with chronic conditions like autoimmune diseases, like sarcoid, sleep is an issue. So all of these cannabinoids together make a full spectrum product that on a cellular level has a very, very good response when we're talking about inflammation. Again, CBD or cannabidiol is a non-psychoactive cannabinoid. Unlike THC or delta-9 tetrahydrocannabinol, CBD will not have any psychotropic response, so you won't get high. So we use CBD in a lot of conditions that deal with inflammation, that deal with pain relieving, that deal with the immune system and putting the body back in balance. The way that CBD works, the way that THC works, the way that all of those cannabinoids work in our body is they work by modulating the activity of the endocannabinoid system. This system was discovered in the early 1990s, and this system is deemed the most vital regulatory physiological process in our body. And what's great is that every vertebrae has an endocannabinoid system. And it's imperative that this system stays in what we call homeostasis. It stays in balance, because when it doesn't, that's when inflammation occurs. That's when pain occurs. That's when our metabolism or our digestion becomes out of whack. We develop GERD, we develop reflux, we develop a lot of the GI issues. Even the endocannabinoid system modulates and regulates our cardiovascular function, our blood pressure, as well as inflammation and pain. It modulates and regulates and keeps our immune function in balance. We talked about how the immune function is in disarray in sarcoidosis, where our body thinks that our organs are foreign. So our body starts to attack our eyes, our liver, our lungs. The endocannabinoid system is important in energy balance, as well as thermogenesis, memory, learning, synaptic spasticity movement that we may see in those who have Parkinson's disease, as well as, and very important, it regulates stress, mood, and the sleep-wake cycles. Again, the endocannabinoid system is made up of receptors that are looking for cannabinoids like CBD and THC to keep the body in balance. The endocannabinoid system has receptors throughout our entire body. Our entire body has receptors that are found in the brain, the lungs, the liver, the kidney, the colon, the immune system, the adrenals, the spleen, the eyes, the muscles, the reproductive organs, as well as the pancreas. So you can see how important it is to understand that CBD and THC and the other cannabinoids that we talk about, when we take those in internally, that they go directly to these receptors that our body is looking for to keep our body in balance. And just to remind you, sarcoidosis attacks almost every organ and gland in our body. Our brain, our lymph nodes, in our neck, in our chest, our lungs, our liver, our spleen, our eyes, our joints, our heart. And guess what? The receptors that are found in the endocannabinoid system are found in these organs and glands that are being attacked by those who have sarcoid. So how can CBD help? Well, research has found that CBD, cannabidiol, to be effective in providing relief from sarcoid and side effects that we typically see in patients that are receiving treatment. CBD, we talked about, protects the immune system, and it does that by lowering the viral load and developing a higher number of T cells. And T cells aid in treating sarcoid as it reduces the formation of the immune cells into clusters. CBD also helps to protect our kidneys, right, by lowering the cell death and kidney inflammation, as well as calcium metabolism, where we see those with sarcoid develop a lot of kidney stones and even chronic renal failure. CBD is also an antiviral and antibacterial. Again, studies found that CBD acts as a natural antibiotic and can be effectively used to treat infections arising from bacteria or viruses. Again, as a result, CBD may be effective in treating sarcoid, as it is suspected to be triggered by what? An abnormal immune response that can be triggered by bacteria or even viruses. CBD is also a safe and effective way and a natural way to relieve symptoms of sarcoid without being psychotropic. So psychotropic meaning that there is no high when you consume CBD. CBD fights pain and inflammation. We know that CBD has antibacterial properties, as well as CBD has been used as an analgesic for over 6,000 years. So again, CBD is a natural relief for pain and inflammation as it relates to joint swelling that we can see in those with sarcoid. So let's move on to our company and our product line. It's important to understand that the FDA does not approve any of these statements. If you are on medication, if you are under a doctor's care, please consult your physician before using any nutraceutical products. It's important to know that CBD is not made equally, and we'll talk about how important that is as the industry of CBD gets bigger and bigger. But a little bit about our company. The name of our company is Wakana, and Wakana was launched and brought into existence just 7 months ago. On April 20th of 2019, Wakana was brought into existence through the synergistic efforts and shared foundational values of 4 African American women who believe that health, wealth, legacy, and freedom are gifts that belong to all people. The 4 co-founders, I want to introduce them to you. We have Melissa Boston, who is our CEO, who has over 29 years of experience in direct sales and home-based business. She retired at the age of 32 and a half years old from corporate America. She brings to us a lot of experience as a social media strategist. She's trained over 50,000 distributors in over 40 countries. She's not only a boss, but an author, an entrepreneur, and the vision behind Wakana. Dr. Patricia Van Pelt is our president. She's a state senator serving her 3rd term here in Illinois. She's an author and entrepreneur, as well as Phyllis Nash is our senior VP of sales. She is what we call our midwife. She will birth every opportunity out of you as it relates to sales. And myself, Dr. Rita J. McGuire, Chief Medical Officer, I bring to you over 30 years in the healthcare industry as an obstetrician gynecologist. I have also been one of the first physicians in the state of Illinois to certify patients in the opioid exchange program. That is a program where those who are on opioids can get a 90-day medical marijuana card in exchange for opioids. I was also one of the physicians that testified for the legalization and taxation of the adult use law that was passed and will be put in effect in January of 2020. So we have products at Wakana that you can trust. In 2018, President Trump signed the 2018 Farm Bill. And that Farm Bill, after 80 years, descheduled hemp. No longer is hemp a Scheduled I controlled substance. During that time, what we saw were hundreds, maybe even thousands of CBD companies popping up everywhere. And what's important to understand is that not all CBD is made equally. I'm sure if you're on the line, you may have noticed that there are CBD products sold at the gas station. There's CBD products sold at many smoke shops and barber shops. You name it, you may see CBD. Not sure that you could trust CBD products that are sold at the gas station. Why? Because it is important to understand that CBD, which is extracted from hemp, which contains the legal limit of 0.3% or less of THC, must be compliant with the State Department of Agriculture regulations. And why is that important? Well, it's important because hemp is a bioaccumulator. And what that means is that when you grow hemp, and if that soil that you're growing hemp is not organic, hemp will absorb any toxin, any heavy metal that is in the soil. So our products are compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, and our products are Farm Bill compliant. And that is important that they are grown organically and they are compliant with Section 7606 of the 2018 U.S. Farm Bill. That Farm Bill again states that CBD, to be legally sold and consumed, needs to be extracted from the hemp plant and contain less than 0.3% or less of THC. Well, here is our product line. And our product line not only is double certified, but our product line is third-party tested. That means that that product, before it hits your hands, it is tested to ensure that there is no mold, mildew, heavy metals, or pesticides. And also it ensures that the proper amount of cannabinoids, the CBD, the CBN, the CBC, the CBG, All of the other cannabinoids that make a full spectrum product, along with terpenes and flavonoids, are in the product. So we have two crown jewels here at Wakana. We have a power line that you will see on the left-hand side. That is our line that has the black label packaging, which contain the legal limit, which is 0.3% or less of THC. Our line includes water solubles. Our water solubles are a great product that you can infuse in beverages, you can infuse in food. That's the first product here. It's here in the blue writing. That's our Power Water Soluble. That's a 500 milligram concentration in a 15 ml bottle. Each drop is 1.67 milligrams. Again, this is a great product that you can infuse in your water, in your tea, in your coffee, in your smoothies, in your oatmeal, you name it. It's a great product if you're on the go to use. Again, the dosing is a very conservative dosing. I've been using CBD in my practice for over 3 years now. Starting low and starting slow is how I start my patients. 3 drops in the morning and 3 drops in the evening will give the person that is using our products between 10 and 12 milligrams of CBD on a daily dose. And what's interesting about this is that the Mayo Clinic did a study, and what they found is that those who suffer from chronic pain need between 2.5 to 20 to 25 milligrams of CBD on a daily dose. So even those who are dealing with a lot of autoimmune disease, the Mayo Clinic research shows that you don't need a lot of CBD to address symptoms of inflammation and even pain. Our next product is our Power by Hempranium. Now, Hempranium is a proprietary formulation that we at Wakana have to enhance the anti-inflammatory properties that we find in CBD. We use 3 organic certified essential oils to do that. We use black seed, we use turmeric, and we use peppermint. Those are the 3 certified organic essential oils that we use to enhance all of the properties that we found in that wheel that we talked about that CBD, cannabidiol, possesses. Now, this is a tincture. That means this is an oil that you place underneath your tongue, and you have to hold it for a minute so that the oil is absorbed into the sublingual glands underneath the tongue so that it can get into the bloodstream within 15 to 20 minutes. Again, start low, start slow, 3 drops in the morning, 3 drops in the evening, 1.67 milligrams per drop will give you an average between 10 and 12 milligrams of CBD on a daily dose. The third product we want to talk about is our Culinary Plus. Everybody, well, maybe not everybody, but most people love to bake and cook and infuse their products with CBD. Well, this is the product. It's called our Culinary Plus, where you can bake, you can cook with CBD. This particular product is not enhanced with those organic certified essential oils. Why? Because we know that when you're baking brownies or making cookies, that you don't want to have those extra flavors of black seed, peppermint, and turmeric. So this is a unflavored product, which you can use underneath the tongue as well as cook and bake. Now let's move on to our other power product. That is our topical relief. Now, our topical relief is a great product. Why? Because we talked about in autoimmune conditions like sarcoid or lupus or fibromyalgia, a topical product will be great for those areas that cause joint pain and swelling. So this product contains 200 milligrams of CBD, less than 0.3% of THC, and our proprietary blend of powerful organic essential oils. Those organic essential oils include peppermint, arnica, black seed, turmeric, clove, eucalyptus, peppermint, menthol crystals. It is an amazing product that's in a base of shea butter that absolutely will apply very evenly. But what I love about this product is that you only need a little. And the reason you only need a little is because we've enhanced the CBD with 9 other organic certified essential oils that address inflammation. So love, love, love this product. We also have a product that also contains CBD with the 0.3% or less of THC. It's our other topical product. Now this product is a 500 milligram concentration in a 60 ml jar. So it is a less potent, a less concentrated product for those who have less extreme inflammation and pain. So those who may have a more milder condition that they're addressing. Again, 0.3% or less of THC. Whenever you're dealing with topical products, they don't pass the blood-brain barrier, which allows for those who have random drug screens to use our topical products. So let's look at some of the other power products. I love this power product. This is called Power Hemp MD. It is one of our most potent and more concentrated tinctures here at Wakana. This is a product that many physician offices and pharmacists are using. Because it has a higher concentration, I love using this product when we are dealing with a more severe condition, like ones when we look at sarcoid and lupus and all of the other autoimmune entities. This again is powered by hempranium, which means that this product has the certified organic essential oils with a proprietary formulation where we include black seed, turmeric, and peppermint. We all know the amazing medicinal benefits of turmeric, aiding in anti-inflammatory properties, as well as black seed, BLACK. Black seed is known for its also anti-inflammatory properties, but more importantly, black seed, research has shown that it can rebuild the beta cells of the pancreas. So very important when you're dealing with type 1 and type 2 diabetics. Now this formula contains, each drop contains 2.5 milligrams of CBD. Remember, the other power products contain 1.67 milligrams of CBD each drop. So this is a more concentrated formula. Again, start low and start slow with 3 drops in the morning and 3 drops in the evening, with this formula giving you about 15 milligrams of CBD on a daily dose. Let's move on to our broad spectrum products. So the power products with the black labeling are what we call full spectrum products. That is the cannabinoid profile containing CBD, CBC, CBG, CBN, flavonoids, terpenes, and the 0.3% or less of THC. Now, our broad spectrum products are our pure products. Those are our products in the white label. That means that they contain less than 0.0% of THC. A great, great, great product for those who are on the line that have random drug screens at their job. This is a product you want to take, which is our pure. Our pure comes in, again, the formulation powered by hempranium. That means that we use a special proprietary formula that includes black seed, turmeric, and peppermint. Why? Because these certified organic essential oils enhance the anti-inflammatory properties that CBD allows the body. This formulation also has a special delivery system called nanotechnology. Now, nanotechnology is just a big word that means that this method of delivery allows for the CBD molecule to become more water soluble, which allows the molecule to be more available to the cell. So on a cellular level, our broad spectrum or our pure line has a bioavailability of 98.7%. So it's going to work quickly and more efficiently with that nanotechnology. Our other pure product is our water soluble. Again, a great product to infuse your water, your beverages, your tea, your coffee, your smoothies, your oatmeal, you name it. Water soluble is great for those who are on the go and want to use their CBD in their food or beverages. We also have our gummies. Now, our gummies are a great way to use CBD. Our gummies come in our power line as well as they come in our pure line. Each gummy is 25 milligrams of CBD. Our gummies are not coated, but they are infused. What's the difference? Well, when you have an infused gummy, it will be absolutely more potent to the cells as we address inflammation, pain, and other issues that CBD can address. Again, each gummy takes about 45 to 90 minutes to get into the bloodstream. So you always want to remember, don't eat the whole bottle. Allow the gummy to work. It takes up to 90 minutes to get into the bloodstream. So as we move toward a close, and we'll open it up for some questions, there's two different packages that you can purchase in order to start using our products at Wakana. One package is called our personal use dispensary. This is a dispensary where we give you a $500 value and your cost is $299. So this is a great way to get a variety of all of our products at a wholesale price. So we're talking about a 40% wholesale profit margin when you come in with a personal use dispensary. It comes with some of the Power tinctures, some of the Power Culinary Plus, Power or Pure water solubles, our topicals, our vape cartridges that we didn't talk about tonight, and our gummies. Also with this package, you get an online store. You get an online store for 30 days because you may want to share some of these products with your families and friends, so they can go on your online site and they can shop for CBD products. And also what we have is that we offer 30 days of commission. So each time someone shops on your online store, you're able to make between 20 to 50% commissions. It's a great way to get products for your personal use. And then our other package is our package that gives you a 50% profit margin, or a great way to purchase our products at a wholesale price and the ability for you to sell products in your dispensary. So this is called a full crown jewel dispensary. Your cost is $998 and we give you a $2,000 value. Again, we give you 3 personal dispensaries that give you an assortment of our Power and our Pure lines, as well as we give you a business toolbox, which is a great way to educate yourself through our Wakana University, which is your source for cannabis education and wealth creation. It also gives you the ability to have your own online CBD website where people can come and shop on your website and you can earn commissions, as well as you have the opportunity to bless others with their own online CBD website. So this is a great way to start with the product line, and as a business and entrepreneur, quite honestly, to get started with a business. So let's just do a recap on sarcoid. Sarcoid is an inflammatory disease where our body starts to attack different organs and glands because our body is looking at organs and glands like our lungs, our liver, our kidneys, our eyes, our lymph nodes, our heart as foreign invaders. It's a very, very sad disease. We saw Bernie Mac. He passed away due to complications from sarcoid. Right now, there is no cure for sarcoid. The different treatment options include corticosteroids, tumor necrosis factor inhibitors, but we understand that getting down to the basics when you're talking about sarcoid, really making sure that you're on a plant-based diet and incorporating CBD as well to address the inflammation, to address pain, to address the immune system. Getting that immune system back in balance is a great, great option to holistically look at some treatment modalities. Again, it's estimated that more than 200,000 people are living with sarcoid. Different ages can be affected, but about 70% of patients are ages 20 to 40. So it's really a young person's disease, and anyone can develop sarcoid. They're not sure what is the reason that it occurs, but there is speculations that there are triggers like bacterial infections, viral infections that cause the immune system to go crazy. So we want to make sure that since we understand that there are receptors in the endocannabinoid system in every organ and gland in our body, we want to make sure that our endocannabinoid system stays in balance, stays in homeostasis, so that disease entities that can attack our immune system are in balance. This is one of the articles. You can screenshot that if you want to do some more studies on sarcoidosis. I've listed that here. So right now I'm going to open up the line. If there are any questions, you can put those questions in the chat area. Let's see here if we have some questions. Thank you, Dr. Rita. This is Carol. I was diagnosed with sarcoid in 1981, and I'm the 20% that have had everything you mentioned, in addition to the horrible side effects. And thank you, Carol, for sharing that with us. Again, sarcoid can be really devastating. And when you talk about a lot of the treatment options and all of the side effects, you know, it's important to share this information with anyone that you know that has any autoimmune disease, be it sarcoid or lupus, fibromyalgia, rheumatoid arthritis, any of those autoimmune dysfunctions. Absolutely, CBD can be one of the products, along with a plant-based diet. I can't stress that enough. We can't look at CBD as a magical supplement. We have to make sure that our diet is a plant-based diet so that we can really avoid any inflammatory foods, processed foods that can cause our immune system to be out of balance. How many gummies do you recommend? Cindy is asking that question. I recommend one gummy. Each gummy is 25 milligrams. I love using gummies personally at night, about 45 minutes before it's time for me to go to sleep. I use a gummy to help with the serotonin and dopamine pathways, which improve mood and improve sleep. And we're talking about that deep REM sleep, that rapid eye movement sleep that helps our body restore and to heal at night. Can there be a workshop on thyroid, hyper and hypo, also acne? Absolutely. I will do that webinar next week, Angela. We'll do CBD and thyroid disease. Thank you for that. Good evening. If you come in at a personal dispensary level, do you pay the difference in 30 days to move up to the full package? Absolutely. Thank you for asking that question. You can come in at the personal use dispensary at $2.99, and you can upgrade to that full crown jewel dispensary in 30 days. Yes, you can just pay the difference and then you will get the remainder of your package. Can the gummy be taken with the drops? Yes, there are so many people that do what we call microdosing. Microdosing means that one, you take a little bit each hour until you find what we call that sweet spot, that spot where you see resolution of the symptoms that you're looking to address. So you can use a water soluble in the morning like I do. I'm really on the go. I like to put my water soluble in my coffee or my oatmeal around lunchtime or noontime. If I'm, for example, this is a great example. Yesterday, I had a breech delivery. That means the butt was coming first with one leg and the cord was wrapped around the leg. Well, many of you know that breech deliveries, they really are an indication for a C-section. Well, this patient came in completely dilated and the butt and the leg of the baby was coming out. So I had no other recourse but to deliver a vaginal breech. Well, you can imagine the anxiety that I had and the stress with this woman who potentially could have a head entrapment. That means once the body of the baby comes out, the head can get entrapped in the uterus and get stuck. That is a surgical emergency. So of course, what did I do? I immediately vaped to really bring down my anxiety and panic. So at night, last night, then I followed that up with a gummy. So absolutely, you can add the gummy with the other products like the water solubles and the tinctures during the day. Maybe you may need a vape in the afternoon. Just knowing that starting low and starting slow is a great way to initially introduce CBD so you don't deal with any of the minimal side effects of getting too much CBD. What are some of the minimal side effects that we see in those who take too much CBD initially? Well, they may have excessive fatigue, or they may experience a headache, or they may experience some nausea. So it's really important to start low, start slow. If you're using the tincture or water soluble, 3 drops in the morning, 3 drops in the evening. If you want to do a gummy, absolutely you can use one gummy, not 4, not the whole bottle, one gummy at night. That's what I love using before I retire. Greetings, Dr. Rita. I have a coworker who is suffering pain from a pinched nerve. She cannot relax her muscles. Pain radiates down arm and neck. She's used 8 cream and steroids, didn't seem to help. She wants something immediate relief with no THC. She also suffers from muscle spasms. So she can use our Pure product line. She can also use our Power Relief that has the legal limit of 0.3% of THC. The reason why I recommend the tincture or the water soluble along with the topical is because when you use the topical, it allows for local relief. And when you use the water soluble or the tincture, it will get the bloodstream level of CBD pretty much a consistent therapeutic level within the bloodstream. The topical relief does not pass the blood-brain barrier. So those who have random drug screens absolutely can use our topicals without having the issue of failing a random drug screen. Topicals do not pass the blood-brain barrier and are safe for those who have random drug screens. So yes, I would recommend using a topical, our topical pain relief. Whenever you have any joint issues, inflammatory issues, along with either the water soluble or the tincture, as well as the gummies. Thank you, Dr. Rita, for the comprehensive overview. My mother, who is now 70, was diagnosed back in 1984. She suffers from many of the outlined sarcoidosis side effects you mentioned, as well. The condition is attacking multiple organs. Does CBD have any interaction with prednisone that you are aware of? Now, great question. Drug-drug interaction with CBD. Drug-drug interaction, typically in the research that I have studied, which is extensive over the last 3 years, shows that the drug-drug interactions happen at high levels of CBD. So we're talking about levels upwards of 1,500 to 2,000 milligrams of CBD a day. That's when you start to see drug-drug interactions. Typically, the drugs that interact with CBD, meaning that those drugs may increase their effectiveness, or CBD may decrease their effectiveness. Those drugs include warfarin or Coumadin, those are blood thinners, theophylline, which is a drug we use for asthma, and some of the anti-seizure drugs that we use in children. Again, everyone metabolizes CBD differently. So I can't say that at a 25 milligram dose of CBD that you wouldn't have a drug-drug interaction if you're on Coumadin, which is a blood thinner, or theophylline. That's why it's imperative that if you are on medications, if you're under a doctor's care, if you're on a blood thinner, if you're on medications for asthma like theophylline, please let your physician know that you're starting CBD. It doesn't mean you can't take it, but it does mean that your physician is going to need to do some more close monitoring of your blood levels. That's all it means. Hi, Dr. Rita. Are there dose adjustments required for pregnant patients? Again, if you are pregnant, if you're on medications, if you're under a physician's care, please talk to your physician before starting these products. It's important, again, because CBD and all of its medicinal properties on the body, even when we talk about blood pressure, we see that studies show that CBD is a vasorelaxant. So let's just say, for instance, you're on lisinopril or amlodipine or metoprolol or hydrochlorothiazide, and you're on CBD, and CBD has been shown to be a vasorelaxant. That means it relaxes the blood vessels. No more constriction and high blood pressure, but it starts to relax your blood vessels. Well, absolutely, your doctor should know that you're on CBD, because your doctor is going to be scratching her or his head and wondering why your blood pressure is improving, right? So you always want to know, let your physician know when you're on any nutraceutical, natural, holistic option of wellness. We have 2 more minutes. Let's see, prednisone deteriorates the bone. I have had hip, both shoulders, toenails removed, and also affects blood sugar. Yes, prednisone, steroids, not only are very, very bad medications for bone, but also it causes diabetics and those who have issues with high blood sugar levels to also become out of control. So absolutely, if you're on prednisone, which can deteriorate your bones and can worsen your blood sugar, you want to make sure that if you start CBD, again, let your physician know, because your physician is going to be scratching his or her head and trying to figure out why your blood sugar is improving. Studies show that CBD is an anti-diabetic, meaning that it improves blood sugars, meaning that it improves the inflammation in the beta cells of the pancreas, which improves insulin resistance. So yes, just let your physician know that you're starting the product. So I want to thank you. This has been such a good webinar. Love all of the interactions that we have on Wednesday. I am going to do CBD and thyroid hypo and hyperthyroidism next Wednesday, thanks to someone who recommended it on this feed. And we want to have you invite guests next Wednesday. You know, invite your physician, invite your nurse practitioner, invite your pharmacist, invite any healthcare provider, as well as those friends and family members that you love that may have issues with hypo or hyperthyroidism, because that will be the topic for next Wednesday night. So thank you. We will see you next Wednesday. Have a great Wakana evening.